Okay, I also been asked to explain how do you know you are about to get diabetes, okay, and whether in the same family you can inherit some of these traits from your father and from your mother. And to tell you the truth, diabetes come in families. You know, your mom and your dad will pass this gene down to you, and you will be prone to get diabetes. So many young people in the even 20s and 30s actually already have some sign that they might develop diabetes. Okay, some of the signs are if you get pregnant and you become diabetic during pregnancy, your chance of getting diabetics are very high. Okay, two, if you have hypoglycemia, meaning if you eat something and within an hour or so you're hungry and I gotta eat again, and then you feel sleepy for a while, and then 2-3 hours later you're hungry again. These are signs that your insulins are being secreted too fast, too soon, and meaning not glucose not well controlled. And if you keep yo-yoing your glucose level by eating different kind of food, you will slowly develop diabetes. So all these have to do with the type of food you eat and the first 18-inch of your GI tract, meaning the first 18 inches of your small intestine. Scientists and also doctors now have found out if we cut your first 18 inches of your intestine away from you, bypassing it, we call gastric bypass for people who lose weight, your diabetes almost immediately disappear, subside, cure before you wake up from your surgery. So the first 18 inches of your gut is the crucial area where you develop diabetes. So they have found that if people eat relatively what we call natural food before being processed, like white flour, white rice, then when these type of food pass through the first 18 inches, that's when something changes in there. What exactly changes, we are still trying to find out. That will slowly change the balance of your insulin and insulin resistance. And the insulin resistance slowly goes up, and you keep eating more. That forces you to eat more of the same kind of food to satisfy your hunger. And then slowly over the course of 10 or 15 years, you develop diabetes. So the answer to you is now, what can I do if I come from a family that are prone for diabetic? What do I have to do? So one of the first things you have to do is you're going to stop eating what we call high glycemic index food, meaning food that would you eat almost immediately become glucose in your body, in your bloodstream. So some of the things are sugar, and soda pop, and refined sugar, meaning refined carbohydrate, like rice, white rice, potato, mashed potato, and noodles and all that. You need to stay away from eating that, and if you have to eat noodles, you have to eat noodles that make whole wheat. Okay, so if you eat rice, you have to eat 5-grain rice. All these add lots of fiber to your food, and then when these food go to your first 18 inch of intestine, it will slowly release the glucose into your bloodstream rather than dumping it immediately into your bloodstream. So when that happens, the body knows how to slowly release the glucose level and then control your glucose level by secreting insulin, and then slowly the food will be digested over a longer period of time. Whereas in the past, if you eat lots of we call them refined food, then your glucose level goes up very fast and then drop down very fast. So that's when you have this yo-yoing effect of your glucose. So eating become a very important thing. In our modern society, we tend to drink lots of sugary drink like pop, meaning soda drink. We can drink lots of processed fruit drink, meaning normally fruit drink is good, fruit juice and that is good for you if you squeeze them themselves fresh. But when it's processed, many of the nutrients be taken out of it, and then they add some sugar to make it sweeter. So it's become a sugary drink. So many of these things we need to stay away from. We're going to eat more natural, the original state type of food. So if you can eat like that, you will prevent the onset of diabetes. Okay, so the other thing would be about to do like it's called lifestyle change. You also have to exercise. Exercise have a way of forcing the glucose into your cell and decreasing the insulin resistance. So exercise is very good for diabetes. You don't have to be very active exercise, but walking will be just fine. Gentle exercise would be fine. All these help your body digest your food and also cause the glucose level to rise slowly and then drop slowly over the course of several hours, and then you won't be hungry and you won't be forced to eat again over and over again. Okay, so that's what I consider to be most important part of treating diabetes. Got the lifestyle changes, eating the proper food to regulate the glucose level so that it won't jump up and down too rapidly.